this is unprecedented, at least to my knowledge. Drug diversion is something that occurs in the healthcare industry. It occurs among doctors. It occurs among nurses. It occurs among technicians. That is nothing new. But the far-reaching implication, the scope of something like this is, in my understanding, unprecedented. There have been other nurses or technicians who have been prosecuted for diverting drugs and using a similar scheme, taking a syringe, refilling it with saline for use in a patient. But this, because of his employment as a traveler, working for agencies and being sent around the country to various states, it really has tentacles in all over the country, and so its scope is unprecedented and scary. We received word from the New Hampshire Attorney General's office and the Department of Public Health that they were investigating an outbreak of hepatitis C. At that time, there were relatively few patients who had contracted the same strain as this hospital worker. But that aroused suspicions. The Department of Public Health Services continued to conduct epidemiological testing on patients who received care in the cardiac catheterization lab where the defendant worked. As it became apparent that this case was mushrooming, we were asked to assist, take a look, and so we worked very closely with the New Hampshire Attorney General's office and our federal, state, and local partners to get this investigation off the ground. We're still trying to piece together his employment history. It's been a challenge, to say the least, because he's been in a number of other states, 7 other states aside from New Hampshire. So we certainly know the end point on that work history continuum. We believe we know the beginning of that work history continuum, and our task now is really trying to fill in that space on that continuum. So we're acquiring documents from various states, various hospitals, and really trying to get a handle on where he was in the last decade.